Well, if you're fighting bad knees, you may be able to heal yourself with your own cartilage.
There is a new way to do this now, and a doctor at Beaumont Hospital in Royal Oak calls it the best procedure in the world.
Our chief health editor, Dr. Partha Nandi, has a closer look at the medical breakthrough that may someday be used for all sore joints. Doc.
You know, we're talking about this amazing stuff about a nationwide clinical trial for a new technique in cartilage restoration surgery. Now, doctors in Europe are doing this, but the procedure is still relatively new in the U.S. Here in Michigan, it's only happening at Beaumont Hospital in a trial involving 20 patients. And if the new treatment works, it could have far-reaching implications to improve our health.
About 2 years ago, I was running, and when I was running, I stepped wrong.
Meet Lori Miller, fighting her way back.
My knee popped, and when it popped, there was a chunk of cartilage that tore.
From a nasty tear in articular cartilage.
How tender are you when I press over here?
Not at all.
Let's move it around a little bit. Okay, all right.
Her doctors in Bay City, Michigan were not equipped for advanced cartilage surgery.
You can see that area right there of the white. That's the cartilage defect, or the area of cartilage damage.
So they sent her to orthopedic surgeon Dr. Joseph Gettler at Beaumont Hospital in Royal Oak.
And Lori had a pothole in her cartilage.
Where Lori learned she could heal her damaged knee with her own cartilage.
This here is the scar from the reimplantation, and this is from the scope which they went in and harvested the cells.
Dr. Gettler is running one part of a national clinical trial.
We harvest several tic-tac-sized pieces of cartilage from an area in the knee that does not matter. They are not only grown in culture, but they're incubated on a biological scaffold or membrane.
He equates the process to patching potholes.
And that comes back as a little kind of spongy, gooey thing, and then it's just cut and paste with a very advanced biologic form of what we'll call silicone caulk.
It's called NeoCart cartilage transplantation.
And it really is space-age technology to treat cartilage problems.
The traditional technology involves doctors actually sewing a membrane over the cultured cells, and there is no cutting and pasting. Dr. Gettler says this new way is less invasive and involves a smaller incision. Just an amazing procedure, right? Maybe we tell people, that they're watching, why this is so revolutionary.
And if we can fill potholes and do it in a minimally invasive way with a high success rate, then the implications are great because we can prevent arthritis from developing later on in life. Right now we're just talking knees, but as things develop, we're going to be talking any joint in the body.
And because of that, he believes his patient, Lori Miller, is one lucky lady.
In her mind and our minds, she lucked out because now she got the latest, greatest cartilage reimplantation procedure probably in the world.
And so how cool is this to have this done to you and avoid some of the bigger procedures? How does that make you feel?
A lot better than I was nervous going into it, but I feel amazing now that it's done.
Well, keep in mind, this is not a procedure for someone who's already developed arthritis, so it's basically not for seniors. But Dr. Gettler says it is for patients who are 18 to 55 years of age who have a fine cartilage injury, or as he calls it, a pothole that can be filled to keep it from developing arthritis. I'm Dr. Partha Nandi.
So is it available?
I think it's going to happen soon, and if it does, it's going to be revolutionary because I think the time for recovery and the injury is going to be less. So I'm excited about it.
Wow, that's great. So many people need knee surgery
Big time,
these days.
big time.
All right, let's turn to the